One of the things you spoke out against was the people you are describing as armchair critics who are questioning government's COVID-19 response, but particularly the measures that many are saying now no longer make sense. And given your handling of it, I'm thinking of the flip-flopping on the children and masks, for example, in schools. That was changed all in one day after a last-minute gazette that was literally done on the 11th hour. You understand why people will look at your department and will say, hang on, does the left hand know what the right is doing?
Well, that was really an error in the sense that the issue of the children at school and the mask, it was not a change of the gazette. It was never in the gazette. It's the colleagues who trying to summarize and do a media statement. That matter was never the gazette. The only reason the gazette, we're consulting over time, and it wasn't because we're not ready, but it's because the expiry of the other gazette was only at midnight of the day. So what was required was to gazette closer to the expiry of the previous one, which was the post-disaster recovery regulations. So it was just a handover, but that issue, I know that many people got it wrong to say it means we changed the gazette last minute. No. The issue of schools, the only thing which is in the gazette is that
Sure. I accept what you're saying, Minister, but I remember speaking to the Deputy Director General who cleared it up on this show and said, yes, indeed, children would no longer be required to wear masks in the classroom. In a matter of hours, there was a statement from your department contradicting that. And so when you then make the changes literally at the 11th hour before they're about to expire, it does give the impression to the public that the left hand doesn't know what the right is doing.
Well, it's not a good picture, in the public communication in any way. I mean, as people who deal with public communication, yourselves, you know that, I'm not disputing that error put a real disrepute to the department, but all that I'm correcting is that it was an error of, somebody was trying to summarize what is actually not even in the gazette. So that's the only thing. I'm not saying it was not a disreputed kind of a communication. It definitely was, and we regret it has happened. But once you picked up the error that, I was surprised when there was a debate during the course of the day, because I said, but this is not a matter which is anywhere in the gazette. And that's when they explained that they tried to summarize. And of course, that just causes more confusion. But maybe, I don't know, coming back to the actual issues, the fact where we differ with some of the people is the fact that, and you can read, it's not only ourselves, but it's other health experts who agree that the idea to say, let the virus simply just spread. There is no use in trying to control how it spreads because it's already all over. Other public health specialists also agree that that can be an approach because there are people, I'm one of those who have not yet had the virus for the last 2 years. And I don't know.
But you're one of the exceptional few, Minister. We've had experts who say, hang on, you are trying to hold on, your own figures tell us that nearly 80% of us have been exposed to this thing. So why are you preventing something most of us have had an encounter with instead of encouraging vaccinations and really making sure that the people who are likely to fall seriously ill or die are the ones who are taken care of and letting the rest of us continue with life?
It's not either or. Our argument is that it's not either or.
But if most of us have already been exposed to it, what are you preventing?
But remember, Bongani, even when you have been exposed, it has been amply shown that even when you do get a second infection, a breakthrough, it can be even more serious.
Which is why you must encourage vaccinations instead of preventing the spread of something we've all got.
The point of the matter is it's not either or. We encourage vaccination. The question is, the point here which we differ, it's not either or.
But what you're not considering, Minister, is the continuing damage to the economy and life as normal in South Africa because of some of these regulations.
Like which regulation damages the economy?
We can talk about the damage to the tourism industry, for example. I'm trying to, Minister. I'm trying to. We can talk about damage to the tourism industry, for example, because of what has been required for international visitors, as an example.
No, but that requirement you will find in many countries. In fact, there are many visitors, I can tell you, Bongani, there are many visitors from various countries who will be reluctant to come to South Africa if they get an impression that we are just laissez-faire. We don't care about people's health. We don't care about the risk. They will be very reluctant to come if they know that, in that country, they don't even check whether you're vaccinated. You can hop into any crowded place. There is no protection because they know what there are many countries which even have more stringent requirements than us. And I can tell you now that if we just go laissez-faire, many visitors will be reluctant to come to this country.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.